Good afternoon, everyone. Thank you so much for joining us. We are recording this session. We want to thank you for taking the time to join us for this session about how to prep for the RT interview. We're also going to send this as a recording to those who weren't able to come because we want everyone to have the best chance of doing their best at the RT interview. And so thank you. We have some slides prepared for you. And what we will do is then take time for questions at the end. Along the way, if you do have questions, though, please raise your Zoom hand and we can call on you. I think that's the easiest way to do it, but definitely there will be time at the end to ask any questions that you might have. My name is Georgiana Sergakis. I am a faculty member and program director for the Respiratory Therapy program and excited to see you here.
Hi, I'm Kaylin. I'm also a student. Myers is Kaylin. I'm a senior, and then we have some juniors here. They'll introduce themselves.
I'm Grayson. I'm a junior.
I'm Kayla. I'm also a junior.
And I'm Ilmi, and I'm also a junior as well.
Wonderful, thank you. So we're just going to go through our slides. The first slide is really just what to expect when you get here, what will happen at the interview. The interviews, I think, mostly are scheduled already. I think we're just trying to get a hold of a few people to finalize our interview schedule, but they start as early as tomorrow and end at the beginning of April. But we're just going to kind of go through what to expect when you get here. So Taylin's going to go ahead and start.
Yep, so there'll be two interviewers. We'll have a faculty member, whether it's George or one of our other faculties, and then you'll have a senior. You might possibly see me, or another senior RT student. Then there's going to be within 20 to 30 minutes of the first portion is going to be a writing sample. And that one you'll be talking about the scope of RT, homework you've done, people you've talked to that know about the profession, things you've read about, videos you've watched, just anything that you've learned about the profession itself. So that way we know that you know what you're getting into if you get into the program. Then you're also going to write about process to become an RT. So become a registered respiratory therapist, since there is a way to get there.
Right. And we have some tips for that coming up. So stay tuned. The second part of the interview about the last 30 minutes of it is an actual oral interview where you'll sit down with that student, the senior student, and a faculty member. And we really explore maybe some of the things you've already written for your application, like in your personal statement or things that you've shared with us in your experience record. It's not that we're not going to look at the information, but we're going to ask you more questions because the time with us during the oral interview is really just to get to know you better and allow you to tell us more about yourself and why you want to be a respiratory therapist and why you want to join our RT family. So, in a kind of general sense, we'll ask you why you want to be an RT. Sometimes you write a little bit about that in your personal statement, but, we'll ask you specific questions about your long-term career goals and short-term career goals, kind of where you see yourself, areas you might see yourself working in the future. So if you've done some homework about the different areas, which there are so many that an RT can work in, maybe tell us, we don't hold you accountable for that plan, so don't worry about that. But, things that you've learned, things that were interesting, like you might share. I really am interested in working in neopeds because that population is really intriguing to me. And I've always wanted to help, small babies that are born prematurely as a respiratory therapist. That's just an example. We're also going to ask you about your experience working with people. Sometimes that's something that you've put in your experience record, but anything counts here. So if you've had previous jobs or if you've had extracurricular activities, we're going to ask you to tell us about those, because those have all really helped shape you to being who you are today, and they'll shape you into being a great respiratory therapist as well. So we ask you about that. We also ask you about leadership experience, and we define that however you define leadership. So, you can be an informal leader. You can be a leader in your family. You can have formal officer positions. We ask you to go back as far as 5 years. But, anything you've done in the last 5 years that's in the leadership bucket, we give you a chance to tell us about that. And the reason we do that is because leadership is a focus of our program. We have a great history of producing the leaders in respiratory therapy, in other healthcare fields as well. So we want to hear about your leadership journey as well. And that can be anything that's relevant to your journey. We will also ask you about some situations, like what would you say to a respiratory therapist or a person, and it just in the moment allows us to see, if you are able to connect kind of how to respond to some of those questions, to some of the kind of core values of being a healthcare provider, like empathy and treating people fairly and equally and those kind of things. So the situations are helpful. Sometimes those questions seem to come out of nowhere.
Mm.
But thinking in the moment, thinking about what would you say to, for example, a respiratory therapist that smokes, what would you say to them? That's actually the question. And if you watch this video, then you'll know and be able to prepare for that. We are located in Atwell Hall, which is on the medical side of campus, and our office is on the 4th floor, room 431. Please, if you are coming up to the office area, and you will be expecting you, but sometimes we're running from teaching a lab or teaching a class, and so we'll be there to greet you and get you started. Certainly if you run into any challenges getting here, or have any issues with your interview time, you can respond back to your email invitation, Alexis, and she can quickly get that information to one of us who's scheduled to do the interview, so that we know that you're running late, or something came up. Okay.
All right, so the next slide was, we're going to be talking about how you did what you did. How did you prepare for your RT program interview? And we're going to open that up to our junior students. The first question being, did you shadow a respiratory therapist before applying, and how did that help you prepare yourself for the interview?
Okay, so I actually shadowed a respiratory therapist before applying. I shadowed my cousin at Nationwide Children's Hospital, and that kind of gave me like a better perspective of like what they do on a day-to-day basis, because like only so much information you can read about. You don't actually get to see what's like happening on the actual day-to-day life as a respiratory therapist. So I feel like that helped me prepare really well in that sense, like knowing what I'm going to get into. And also at Children's, they have like a lot of different like cool things like ECMOs and stuff like that. So I kind of got to like learn about that before actually learning about it in class. So it was pretty cool.
Yeah, I would just add that like shadowing is not a requirement for the application, but just like Elmi stated, it gives you a snapshot into the world of respiratory therapy, and it could give you some things to talk about at your interview. At the end of our time together, I will post some things in our chat, which include our shadowing context. So if you don't already know someone, I'll give you some mechanism of how to contact someone about shadowing.
The next question is, did you talk to an RT about the profession?
So I had a RT that I had like a PFT, which is like a function testing for myself, and I was just interested in what they did. And at the time, I didn't know everything that an RT did. I really only knew like the outpatient stuff. But I just kind of asked a lot of questions. I talked to them about what the roles are, what the responsibilities are, kind of found out that there's a lot of areas that you can get involved in. It's a lot of different inpatient, outpatient stuff like that you can do. And I also just asked about, what kind of like work is being done, what does your life look like, everything like that. And it was really helpful in helping me decide to think that this is a good uh career to go into.
And then the next question is, did you watch videos about the RT profession? And I'll be answering that one. So I didn't get to shadow anybody before applying, but I did watch a lot of videos on YouTube. And there are videos such as One Day in the Life of an RT, like what it's like to be in an RT program. It wasn't necessarily about the OSU one, but just in general, how you do get to learn a lot about a patient in general, not just only the respiratory portion of it. It's a little more comprehensive. Then also just things that I wish I knew before becoming an RT, and just it was a lot about how they're not very much recognized. But that's something that if you guys get into this, you'll also see that yourself. But yeah. Then the next question is, what kind of research did you do?
Yeah, so I'll answer that. Some research I did was I looked into, there's a website called Be an RT. I looked into that where you're able to learn more about what becoming a respiratory therapist looks like. And then I also utilize the Ohio State Respiratory Therapy website where it gives you sort of like a outline of the curriculum and clinical or research opportunities available as well. And then I also spoke with the current senior by the time I applied, so I kind of gained perspective from them and what experiences they might have enjoyed while in the program. So if you have the opportunity to do that, I would do that as well. But there definitely are a lot of resources at your disposal to learn more about the program and the profession itself.
So Kayla mentioned BNRT, and here's the website for that. And I'll post these all in the chat too at the end of our session, or when we get to the question and answer session. But there are also, besides our website and the BNRT website, there's also morerts.com, which is a national campaign that is a collaboration between the AARC, the NBRC, and COARC, which is our professional association, our accreditation association, and our credentialing association. They all got together and have created increased awareness for respiratory therapists. And because it's a field that's such in high demand right now, that's why it's called More RTs. But there's some good videos on there as well, where you can see the different pathways that you can take. They highlight some patient stories, which, demonstrate the value that we have on each individual's life, based on how we interact with them. So there's some inspirational stuff on there, as well as some other information that could be helpful. The AARC is our professional association. You can click around that website and see what's happening, what's the latest news in the profession, to get an idea of that. There are links to BNRT and More RTs on the AARC's website. And then finally, the MBRC is our credentialing agency. So remember at the beginning, Talon said that you were going to have to write about the pathway to become a registered respiratory therapist. The NBRC website is your best resource for this because it is the credentialing exam that they offer. And so they have some great infographics on their website and some information that you can definitely check out to see how you could become a registered respiratory therapist through their credentialing exam process. Yeah, anything to add?
No, just do
Okay.
your homework. That's all we have the resources, and it'll definitely make you feel more confident. Because I was really nervous during the interview, but I also had a notepad that everything that I did my homework, and I was prepared to answer all the questions because of that. So definitely use your resources.
Yeah, and there's no rule against bringing your notebook with you. If you're talking to us and you forget, oh, I remember I looked at this website or something, you can always look at your notes and say, oh, there it is. Because in the moment you might be nervous. I don't suggest that you read your notes verbatim when you're talking to us, but you can have a supplement with you that can jog your memory if you need it.
All right, now we're going to go over a little bit about what our ideal candidate would be. So they would have academic achievement, which is consistent or improving trend. So it's possible that you didn't do so well on your grades as a freshman or sophomore, but that won't disqualify you. Grades are only 45% of what we look at. The other 55% is your own personal statement, your personal experience, the things that you say during the interview. So if you said something during your personal statement and you'd like to expand on it, you can do so during the interview. This is when we get to learn more about you as a person, not just what we see in the grade system. Then we would also, you can describe the scope of the clinical respiratory care practice in considerate detail, including the roles and responsibilities of an RT, the diagnostic, therapeutic, and rehabilitative aspects and clinical specialties. So we want you to really know what it is that we do, because that's something that if you really want to be into it, then you would know it. I don't know how else to explain it. You'd want to know what you're doing, and we want to know that you know what you're doing. Then you'd identify at least one realistic advantage or opportunity for a bachelor's degree as an RT, because you can get an associate's degree and find a job. But there's another aspect. This is a bachelor's degree. So we want to know that you understand realistically why it is a good thing to get a bachelor's, even if you could just go for 2 years to get an associate's. So that, and then also all the requirements to become a licensed and registered respiratory therapist, as we mentioned earlier. You can use the NBRC website credentialing to find that out. And then at least one realistic positive and one realistic negative aspect of being an RT. And again, you could do some research or ask people questions, what we think that is a negative or what we think is a positive, and how you feel for yourself, if that's a negative or positive.
Yeah, I don't recommend you Google the worst things about respiratory therapy, but maybe in your discussions and all your homework, you found out that working in critical care units, not all the patients successfully survive. That's a common thing that people share as potentially a negative, right? We're not always gonna, despite our best efforts, aren't always gonna save everyone. So that's just an example. It's just, we ask you the question in terms of what do you look forward to the most and what maybe are you not looking forward to as much, right? That's how we ask the question. So for the ideal candidate kind of continued, right? Taylor already mentioned only 45% of that decision is based on your cumulative GPA and your science math GPA. So we actually look specifically at your science math courses because they're a great predictor of how well you'll do in our program. I have to say though that, if I personally, a long time ago, did not enjoy physics that much as a prerequisite. It was just not a class that I enjoyed. But when I got into the RT program and physics was applied, and we were talking about ventilator flow rates and volumes and things, and it was actually something that made sense to take care of a patient, then I liked physics concepts. So, we're looking at science math GPA, but it's not necessarily like Taylor said, your academic record should show a positive trend. And we want to know, any special circumstances that you can tell us about in your interview. If something happened in your life during that one semester that is kind of like not a stellar mark on your academic record, please tell us about that, right? We're considering all the things that make you uniquely you, and sometimes you have to bounce back from things and you work really hard, and those kind of things are important to share as well. We look at your personal statement. I know you've already submitted your application, so you can't go and change that. But the quality of your writing and the relevance of your past experiences, especially customer service kind of related experiences working with people, because we're very people focused. Even if our patients are unconscious, we're still working with nursing and the physicians and the PTs and the OTs and everyone in the healthcare system to work toward that patient-centered care. We also want, to know that you've done your homework, right? We've told you, I don't know how many times already, to kind of, take some initiative and become prepared. If you've done that and followed the advice we've given you, then you score higher. We have a rubric in your initiative and commitment, right? So all the things that we're recommending all kind of contribute to kind of maximizing your score on that interview. And then, if your goals are aligned with our goals, and our goals are clearly stated on our website, that we have a focus on leadership and we have a focus on producing some of the best respiratory therapists that the country has. So, we're looking at that alignment as well, and that you're able to communicate and effectively both in writing and orally. So talking to us, because we are very interpersonal kind of related healthcare profession. And then finally, professionalism. That's something that we also focus on in the program to make sure that we're able to grow those professional abilities and those professional service-oriented and leadership attributes, right? So we're looking for all of that, and all the questions that we ask kind of allow us to make some kind of get an idea of how you fit in those areas as well. And so now it's time for your questions. What questions do you have? You can, okay, Josephine, go ahead and unmute yourself and ask the question.
Hello, my name is Josephine. I have a question. So my question is, how do you expect us to show up to the interview? I know it's supposed to be somewhat formal, of course, no scripts. So how would you like us to show up to the interview?
So since it's related to that comment that I just made about professionalism, I would say that you're safe to have kind of a business casual kind of look, not scrubs, but kind of a professional kind of look, that fits within your fashion sense, I guess. And I mean, if you Google business casual, you'll get lots of suggestions for that. I think that's a kind of standard across the board for interviews. But you're right. Scrubs, unless you're coming straight from work, and then you can tell us. I scheduled my interview based on I wanted to get here the first chance I could, and I'm coming from my work as a PCA, and so that's why I'm wearing scrubs. I mean, again, we're a small program and we take into account individuals and individual differences, but I think my standard answer is business casual. Mhm.
Okay. And from my understanding, you guys only have 22 students per cohort.
Correct. We have approval from our accreditation agency to accept 20 students per cohort, and we can flex up by 10%. So that means our maximum capacity is 22 students per class. And there's lots of good reasons for that. And that is because we keep our ratios very low for faculty to student ratio. And in clinical, we only, we'll put you together in small groups of 4 or 5 students at a time so that you can get that individual attention and preceptors that will help you. So that's why we're limited in terms of our maximum cohort size right now.
Okay. Thank you.
Mhm. Okay, so Marshall has a question. Oh, doesn't have any questions. All right, sorry, just reading your chat. Okay. Any other questions for our students that are here too? So I'll stop talking and let them answer the next question. You're certainly welcome to ask more than one. Okay. Well, having no other questions, I want to thank everybody for attending this afternoon. We look forward to meeting you at your interview. If you think of questions beyond today, please respond to Alexis's email and she will make sure that we get an answer to your question. But we look forward to seeing you here in Outwell Hall. There's a good chance you're going to see one of us because we're doing a lot of those interviews, but you just also might see Grayson and Kayla and Elmi in the hallway. So please say hi and come and relax and be yourself. That's the biggest advice that I have for all of this, is that we just want a chance to get to know you beyond the paperwork that we have in our application files. And we want to enjoy getting to know you and understanding why you're interested in becoming a respiratory therapist. All right. Thank you, everyone.
Excuse me, I just thought of a question.
Oh, good.
For clinicals, are we going to have a rotational clinical where we're placed in different environments, or is it going to be limited to something specific?
So do any of the students want to take that question?
Sure. So you will get to be in the ICU, intensive care unit. You'll be able to do a rotation during the summer in pulmonary rehabilitation so that's outpatient. They'll also do a rotation in PFTs, pulmonary function testing, also outpatient. You'll get to do a sleep clinic at nighttime, and also, so that's when someone's gonna stay overnight and check to see what kind of sleep issues they have, so we can fix that. Then there's also going to be a rotation sleep clinic during the day where we see them. It's been like a month or something that they've had, or years that they've had their machine, and we help with them with that. There's a lot of different rotations. So we don't just only do hospital, we also do outpatient, but we also do a lot of hospital. We do children, all kinds of ages, neonatal, babies, like preterm. Yeah, we do a lot.
Yeah, by the end of the program, you'll have 950 clinical hours total, and you will have visited all aspects of respiratory therapy. And then the wonderful thing about the program is the last 8 weeks, you can actually customize which clinical you'd like to return and go and see more. Maybe if you were interested in specializing, or if you really wanted to, go to a hospital that is in your hometown to see what it's like at that hospital department. There's a lot of flexibility there. I don't know if any of the juniors want to say anything about how many clinicals you've done so far and kind of the focus of that.
I can go. So in the first semester, you don't immediately start in clinicals, but you pick up kind of towards the end, and those are basic clinicals.
by basic clinicals, he means just floor care. People aren't super intensive. They don't need critical care at that point. So you start off easy. We don't just throw you in the fire. You get time to learn and feel comfortable. We won't yet. There's a lot of competencies that we do before you get into clinicals. So that you're ready, so that no one's at harm, because you're going to be touching patients and everything. So
Yeah.
And you have a preceptor there with you too, to make sure that you feel comfortable where you're at as well.
Yeah, you always have a clinical preceptor anytime you're in a clinical education environment. So because you're learning, we have a registered respiratory therapist that's there to teach you the way and give you feedback and help you improve your skills. Does that answer your question, David?
Yes, it does. Thank you.
Okay. Any other questions? All right. Well, thank you for spending some time with us this afternoon or for listening to this recording. We want to thank you so much and can't wait to see you when you come for your interview.
Alrighty. Thank you.
Take care.
Have a good day.
You too.